Karolinska University Hospital aims to increase value for our patients by introducing a new operating model for university hospital healthcare that will better integrate care, research and education. We also want to address the challenges of a fragmented organisation, varying quality of care and recurring economic problems. We have reached the conclusion that to increase the value we deliver to our patients, we need to focus more strongly on the patient's pathway throughout the entire care process. It is together with our patients that we create value. The focus is on value that makes a difference to patients, that is to say, the medical outcomes, how the patient experienced the care process, and not least their involvement in decisions about their treatment. These results are then put in relation to cost of achieving those outcomes. This is how we define value. The main strategy on which our new operating model is based is therefore value-based healthcare. A few years ago, we began to change our ways of working in accordance with value-based healthcare. Now, we are changing our organisation accordingly. Every day, we meet more than 4,000 patients with many different needs. We categorize them into around 200 adult groups and 200 pediatric groups with similar medical conditions, for example, heart failure, breast cancer, or pediatric diabetes. Our new organization is based on patient groups which form a patient flow, either independently or together with other similar patient groups, where we can clearly follow the patient's pathway through the care process. A number of patient flows are then organized into various patient areas, which in turn are organized into 7 themes of different sizes. The children's and women's health theme has about 30 patient flows, while the heart and vascular theme has about 10 patient flows. As the patient moves through the care process, he or she will also come into contact with, for example, emergency care, surgical interventions, imaging, laboratory, dietitians, and psychologists. These are resources and skills that most of the patient flows will be in need of, and they are organized into 5 different functions. Our new organization is based on the patient's needs and the patient group instead of clinical specialities, as was the case previously. However, the development of medical specialities is even more important than before, since Karolinska's task is to provide highly specialized academic healthcare, research and education. Within each theme or function, the role of a chair of speciality will be appointed. This role will ensure that the clinical specialities are cohesive and will be responsible for their development. We are now raising the level of ambition for university hospital healthcare of the future. An important part of our new organization is to harmonize with Karolinska Institutet in such a way that care is integrated more effectively with research and education. There is a representative at the corresponding level from Karolinska Institutet for each level of management at Karolinska University Hospital, and vice versa. In today's complex healthcare, cooperation is key in creating value for our patients. Over the past years, we have seen how cooperation, both with patients and around patient groups, has increased, and the new organization is designed to make this collaboration even easier. We will bring together patients and different professions and disciplines in interprofessional and interdisciplinary teams working for each patient flow. Our understanding of the word inter is that everyone who works in the team will strive towards and contribute to the same goals. In short, they will cooperate. Cooperation between different professional skills will also mean that research, innovation and education can be better integrated with care. In the new organization, we will share patient care areas, resources and staff. No one owns everything. Here too, we need to cooperate. One important aspect is that decisions are made as close as possible to the patient and to involve the patient in the care process. Decisions must be based on data related to the goals for the specific patient group. It is important that we do not just follow up the outcome of the different interventions separately, but also the overall end result for the patients. The patient flow is the most important element of the new organization. The results for each patient group are evaluated and decisions to prioritize improvement efforts made. The patient flow is such a central aspect that each flow has a head of patient flow, a management team for the patient flow, and a patient representative. The role of the head of patient flow is to design, follow up, and evaluate the work done throughout the flow. The head of patient flow is also the first-line manager for the staff who work within the patient flow. One or more patients and/or family representatives will contribute with the patient's perspective on the care process. Other roles that may be needed in the management team for the patient flow are doctors, nurses, and representatives for the functions. For example, radiologists and physiotherapists. A researcher and teacher who is connected to Karolinska Institutet will help develop the research and education activities that are linked to the patient flow. Other non-clinical professionals, such as controllers and business developers, may also be included. The management team for the patient flow will bring together skills that can improve patient outcomes and define success factors for the various patient groups. The management team will also define the outcomes and monitor the results for the patient groups it is responsible for. The team will also ensure that new methods from research and innovation can be evaluated and implemented promptly in the care process. In order for Karolinska University Hospital to succeed in increasing value for patients, it is crucial that there are skilled staff and managers within all occupational categories who take responsibility, show compassion, and have a holistic approach. All managers have full responsibility for the integration of care, research, and education, as well as for staff and economy. Therefore, they must collaborate with each other to be able to deliver best possible healthcare. We are currently in a process of far-reaching change, where we focus on the patient's pathway through the care process. We are continuously developing and improving our organization and our ways of working on the basis of lessons learned along the way. With the new operating model, we will be better equipped to measure and follow up the various parts of our activities so as to be able to provide the best possible care for patients, both today and in the future. Research will become a natural part of the patient flow so that we can rapidly identify new research areas, implement new research results, and improve the education of tomorrow's healthcare staff. Care, research, and education, our mission. Together, we create the best healthcare.